There are dozens of different migraine classifications. How do you know which is the right migraine medication for you? Quick disclaimer, as with all our information, we are trying to make patient education more accessible, yet this is never a substitute for medical advice. There are 3 different types of migraine medications. 1 is the acute medication, 2 is the preventative medications, and 3 is the other additional medications that are, for example, for symptoms such as nausea. I'm pretty sure most people know the first type of acute migraine medication. They are called non-steroidal anti-inflammatory drugs. And because this is a very long and complex name, we are going to abbreviate those to NSAIDs. Some very common examples are ibuprofen, diclofenac, or naproxen, and those can be bought over the counter, and some of the NSAIDs can also be bought via prescription. The second type of migraine acute medication are triptans. Those are prescription drugs and they are specifically designed for migraine attacks. They can be taken as shots, as nasal spray, or via pills. And some very common examples are zolmitriptan or sumatriptan. If triptans are specifically designed for migraine attacks, how do they actually work? Well, science is not entirely clear on what is causing migraine, but the most respected theory is that during a migraine attack, the vessels in the brain are widening, and triptans are reversing this. So triptans make blood vessels in the brain contract. The second type of migraine medications were preventative medications, and I'm going to talk about 5 subtypes. The first type of preventative migraine medications is lowering the blood pressure, and one example of this is propranolol. Subtype 2 are antidepressants, and the most common example is amitriptyline. Subtype 3 are anti-seizure drugs, so drugs that you're usually taking when you're living with epilepsy, and one very common example is topiramate. The fourth type is called CGRP monoclonal antibodies. It sounds very complicated. It's a newly approved drug that is specifically designed to prevent migraine attacks, and a very common example is Aimovig. It's usually injected and is done once a month or in a quarterly duration. And as the name suggests, they are working by targeting the CGRP. CGRP means calcitonin gene-related peptides. Those are substances that are released during a migraine attack. The 5th subtype of preventative migraine medications is actually Botox. It's a quarterly injection that is only accessible to people living with chronic migraine. So we have been covering acute medication, preventative medication, and I was mentioning a 3rd type for migraine medications that are additional medications. And in this case, I'm talking about antiemetics, so medications that help you to prevent nausea. A common example of an antiemetic medication is domperidone, and this is usually working way better when you take it early, so in the onset of a migraine or headache attack coming on. Right, now we have been talking about the 3 migraine medications, but what is now the right medication for you? Well, as I said in the beginning, we are trying to inform you, but this is not a substitute for doctoral advice. The NHS and the American Association of Family Physicians are recommending as a first-line treatment NSAIDs to people living with mild to moderate migraine attacks. People who are experiencing moderate to severe migraine attacks should be given triptans. And people who are not responding well to treatment or who are experiencing especially severe or frequent migraine attacks, they should be recommended preventative migraine medication. If you are experiencing additional symptoms such as nausea, also additional medication is recommended. Of course, those are not the only factors. There are many other individual factors such as side effects, medical interactions, and medical history that should be considered. But severity and frequency of the migraine attacks are really important to get the right individual treatment. What medication are you taking? Is it working for you? Let us and others know in the comments what steps you were taking to find the right medication for you. If you find this information useful, leave a like and subscribe.